So when we were discussing who to choose to present the patient cases from different countries, we took into the account the positions that were presented at the European Parliament by Slovenian Minister of Health, and we selected the countries that we think are the most representative in the focus of the Slovenian presidency to the European Union. We will have the first presentation done by Professor Teresa Casanovas. She is the leader of the group of patients from Spain, and the floor is yours.
Thank you. Good morning. Thank you for your introduction. ASCAT is a liver patients association. Headquarters are sited in Barcelona. Was created in 2000 by people who were seeking information and treatment for hepatitis C. The objectives since the beginning have been to give information and support to patients in relation to liver diseases. ASCAT is an ELPAS founding member. In 2017, we changed the name of the association, and instead of focusing only on viral hepatitis, we consider all liver diseases. Our objectives in relation to liver cancer, HCC, are prevention and awareness. We know that cirrhosis of any etiology is the strongest risk factor for HCC, and every year from 1 to 4% of patients with cirrhosis will develop HCC. The main risk factors for cirrhosis and HCC developments are hepatitis B and C, alcohol-related liver disease, and metabolic-associated liver disease. And related to increasing awareness, we know that many cases of HCC are preventable, but early diagnosis is challenging due to the majority of patients have no symptoms. So early diagnosis with a surveillance of HCC every 6 months through ultrasonography is recommended by clinical guidelines due to the better therapeutic options if we may have an early diagnosis. Therefore, we need optimized early diagnosis and optimized treatment and care. I would like to highlight 2 recent developments in Spain in the field of HCC. First, since patients with HCC have 2 diseases, cirrhosis and liver cancer, it is important the updating and first clinical practice guidelines published in Spain with the consensus among the multidisciplinary team involved in the diagnosis and care of these patients. And the second one is the commemoration of the 35th anniversary of ECLC staging system. Thank you for your attention.
Thank you very much, Teresa, for your presentation. So we will just fast continue forward in the scope of Slovenian presidency and the review of the region that Slovenian presidency has come forward for. We were saying that we will look at the healthcare systems all the way to Israel. So it's my pleasure to welcome the next speaker, who is the leader of the patient associations from Israel, and he will present the liver cancer in Israel. Welcome, Mr. Julio Bullman.
Thank you very much, Marco. And thank you for the invitation in general to participate in this event. I am Julio Bullman, one of the founders of HEADS, the Israeli Association for the Health of the Liver, and also Vice President of Israel. We founded our association in the year 2000, starting taking care of people with hepatitis C. After we extend to hepatitis B, and now with fatty liver, rare diseases, pediatric diseases, and liver cancer. Our mission is to help patients prevent liver diseases and educate public, working together with stakeholders. Next slide. In Israel, our population is approaching 10 million people. On average, there are 250 cases of new liver diseases, of new liver cancer each year. Most of them, of course, ACC, but we have also cholangiocarcinoma, due mainly to rare diseases, to autoimmune diseases like PSC. And regarding to awareness and prevention campaigns, they have been done by the patient associations with the collaboration of the associations of doctors, liver doctors, oncologists, but I have to admit that they have not been done by the system, by the government, by the Ministry of Health. Only the patient association and the doctor has been taking care and trying to increase the awareness and prevention of liver cancer. Also, our association lobbies concerned politicians, and we created a coalition with the doctors and the media in order to influence those that are making the decisions. So these are part of our activities in the Parliament of Israel. Now, even regarding to access to treatment, we have in Israel, every citizen has social security and is covered all the treatments for any disease. So regarding to liver cancer, also we have in the reimbursement now the best treatments for taking care, especially of terminal liver cancer. So we have but the problem is that these treatments are in the center of the country. They are not in the periphery. So we have ablation, resection, transplant, seared systemic therapy, and also multidisciplinary teams that are taking care of the liver cancer patients, but not in the periphery. We need, of course, that the major problem is the lack of awareness of the risk factors that conduce to liver cancer. So, and unfortunately, the detection occurs in middle and advanced stages. And this is something that we can and must prevent it. We must find better markers which will enable early diagnosis and save lives. Thank you very much.
Thank you very much, Mr. Human, for your presentation. And we will just quickly move forward. So you have seen what is happening in Spain, you have seen what is happening in Israel. And one of the regions that Slovenian presidency is concerned also about is the region of Eastern Europe. And from Eastern Europe, it's my pleasure to welcome here among us Marinela Debu. She's the president of the Patient Association from Romania, and she will speak about patients in Romania. Ms. Debu, the floor is yours.
Thank you for this invitation. I want to tell about us. We are working from 2019. We are starting as with the association from 19th of May 2009, when it was World Hepatitis Day. We are a member of ELPA, World Hepatitis Alliance, and JANT. We're starting with this association. Our principal objective is to increase screening and access to the treatment for patients with liver disease in Romania. Since 2019, we are in some regional part of the country where it's very important, and we are in partnership with civil society and healthcare authority. This means doctor society, who are very important for us. How we work, meetings with patients, we try to have local meeting and national meeting, awareness campaign from All Hepatitis Day or from Mother Day, or very dedicated. We have our website, we have online training for patients and partnership with other organizations. And if you want to visit, our page is hepato.ro or Hepato Romania. What I want to present today, it was a screening program case example. I have this data with supported with Professor Liana Gheorghe, who is a doctor, gastroenterologist at the Convene Clinical Hospital, the most important hospital from my country. Like you know, Romania, it is on top with liver cancer and also with cirrhosis. Just in 2019, according with official data, more like 2,800 people died because of liver cancer. Is 6th leading cause of mortality to the cancer in my country. Romania has the highest mortality due to the liver cirrhosis in Europe. The situation was exacerbated by COVID-19 pandemic situation, and we think the cases of cancer increase it also with this because, like you know, people drinking, the testing campaign is not like before. But in 2019, just before with the beginning of the COVID-19 pandemic, an extensive liver cancer screening starting can stop liver cancer. It was coordinated by Romanian Association for Liver Disease and Romanian Society of Gastroenterology and supported by a pharmaceutical company. Priority of this project, it was patient with NASH, NAFLD, with F3 or F4 post here, patient with hepatitis C on therapy, or patient with hepatitis B with F4, F3. For information and awareness, it was a prepared poster with information about who should come for detection in gastroenterology infections in the internal hospital. Family doctors are involved with some courses, and the use of non-invasive means such APRI, FIB4, or other unupdated marker for depistation of the fibrosis. Each patient who has entered in the program receives a booklet with the next appointment and personalized information. The idea is a caravan and monitoring at every 6 months. Unfortunately, because of the pandemic situation, we hope to continue in soon. The main university of the center in the country are involved when gastroenterologists and oncologists can do multidisciplinary collaborate. The goal of the program is to screen and detect patients with hepatocellular carcinoma at early stage and not to establish a national registry of cancer, liver cancer. In this moment, we have just regional registry. Like I told you, pandemic situation affected also present as a program, because you know Romania is now its leader not just in Europe with COVID-19. My message is, in Romania, prevention of hepatic cancer must become a high priority. Access to the investigation must be easier and close as possible for potential patients. In this moment, access it is just in Universitarium Center, and I think if you have access in much more hospital will be easily. Also access to the therapy as part of the prevention. In case of the viral hepatitis should no longer be a problem. Also in this moment, we don't have from 3 months access to hepatitis C therapy. Involvement of family doctor and assuring the free testing necessary for each potential patient, it is also essential in prevention. Lifelong screening with semi-annual ultrasonography with or without alpha-fetoprotein testing in patients with cirrhosis and selected patients without cirrhosis. It is recommended by Romanian specialists for all at-risk groups, and it is in all the time, or our gastroenterologists have possibility tell to family doctor and the patient to have in mind this. Some steps are being taken. Medical staff are preparing. Patient associations are here to work in collaboration. It is necessary for hepatitis and liver cancer to remain a priority in new medical agenda because COVID-19 increases the number of the patients with liver problems, alcohol, fear, or going to the hospital or limited access. It is for us the main problem. And we think the European authority must get involved as a priority in countries such as Romania and support them in carrying out information and screening campaign. Just to give you one example, in this moment, we implement in Romania Libero 2 East and Sud. And before with Libero 1 East and Sud, we're starting a campaign when we training family doctors, and it was preparing a national register of hepatitis. And now with Libero 2, also with European funders, we test the person for viral hepatitis and save lives. We are testing before more like 2,000 people from all the country. And we continue to testing, and I want to know for us, European funds, it is the key to solve the solution and to have registered and to help people. Together, we are part of this road. And we think liver cancer prevention and equitable access to the necessary investigation and treatment, no matter where are in the European Union, must to be a priority for all. Thank you for your attention.